What are the three most common issues with shoulders?
The three most common issues with shoulders are shoulder impingement, shoulder instability, and osteoarthritis, mainly affecting the acromioclavicular joint.
What is shoulder impingement?
Shoulder impingement occurs when the tendons of the rotator cuff or the bursa become trapped in this space here. This space is called the subacromial space and is formed by the end of the shoulder blade and the ball of the arm. In this diagram here, it shows quite nicely how the bursa is becoming pinched between this space here.
What causes impingement?
There's a couple of reasons for impingement. One of the reasons that we often see is arthritis affecting this joint here, which narrows the space. We also can get thickened tendons in here, which can, again, make the space tighter and cause those tendons to become compressed and impinge. One of the things we typically see in our patients, though, is a problem with the shoulder blade. So if the shoulder blade is either downwardly rotated or forward tilted, this can narrow the space. And this is something that we treat in the clinic on a regular basis.
Can you give me some examples of exercises I could do if I have these problems?
Yeah, sure. So this exercise is for the serratus anterior muscle, which supports the shoulder blade. It helps to bring the shoulder blade up and round when you move the arm. And this exercise is a strengthening exercise. So Lucy, if you just drop down for me. So this slackens the muscle off and then come back through there and hold. And you typically hold this for about 10 seconds and repeat this 10 times. You could progress this into a harder position where you are on all fours on the floor or the bed. This is another exercise we use to improve the muscles that support the shoulder blade, in particular serratus anterior and lower trapezius. We start with the shoulder in an ideal position, so it's going to get Lucy to set into neutral, that's good. And then if you elevate your arm up, Lucy, so she elevates through, she reaches a little bit to activate serratus anterior, and then draws down to activate a bit of lower traps, and now she's going to hold that position and lower her arm down. And typically she could repeat that for a couple of minutes. And finally, another exercise for the shoulder blade. In this position here, Lucy's going to just gently set the shoulder blade so the lower trapezius muscles are working. And holding that position there, without moving the shoulder blade, she's going to lift her upper arm up and hold, and then lower down. This exercises this lower trapezius and improves the control of the shoulder blade. Great for people with impingement.
Thank you for watching this video. If you or someone you know has shoulder pain, please get in contact with the clinic today on 01277 219 553 or at sportsandspinalphysio.co.uk.